Right. Okay. So it's my pleasure to introduce the next two talks. The first is going to be from Zerui Wang of the Case Western Reserve. Oh, there you are. You've moved. University, and you're going to talk about assessing prophylactic and therapeutic efficacy of a cellulose ether compound. Yeah. So you have 15 minutes. I'll give you a sign when you're about 1 minute to go.
All right, thank you for the introduction. My name is Zerui Wang from Case Western Reserve University, and the title of my talk today is Assessing Prophylactic and Therapeutic Efficacy of a Cellulose ether compound called TC5RW on CJD. So let's begin with some background. The neurodegenerative diseases like Alzheimer's disease, Parkinson's disease, and prion diseases are characterized by the accumulation of misfolded protein, and then they will form toxic aggregates. And this pathological process has helped the development of a diagnostic tool like RT-Quick. And this technique will be using to monitor the misfolded protein seeding aggregation. However, there's a need for effective treatment that can disrupt this process or remove the aggregation. So the process that's exploring some small molecules can provide a novel approach to therapeutic targets. We then focus on the cellulose ethers, which is polymer commonly used commonly used as inactive ingredients in food. And in our collaborator, Dr. Doh-ura's previous study, several cellulose ethers could inhibit the formation of prion protein. And we identified TC5RW as a candidate for our research due to its minimal cytotoxicity and its smaller molecular weights, which facilitates the crossing the blood-brain barrier. And in our initial in vivo study, we treated the TC5RW with a single subcutaneous injection into the prion-infected TG7 mouse model. And we can see that the treated mice model in the yellow curve exhibits a prolonged survival rate than the control group. And for our preliminary in vitro studies, we have incubated TC5RW with different subtypes of CJD samples at 37 degrees for 2 hours. And this is the Western blot of the brain homogenate from panel A to panel F. And in panel G is the quantitative analysis of the PK-resistant form at different concentration of TC5RW based on the Western blot result. And we can see that the most common subtypes of CJD, MM1, MV2, VV2, and genetic CJD E200K, V1 ATI showed the TC5RW showed the inhibitive effect at the concentration as low as 2 micrograms per ml. Except for FFI sample, it started to show a significant decrease at concentration at 6 micrograms per ml. And we also found that the TC5RW can inhibit the CJD samples RT-Quick. And in panel A is a CJD skin RT-Quick result. And in this blue line is without TC5RW treatment. Then we started to add different concentration of TC5RW at 0 time point. And we found that this compound showed a dose-dependent reduction. And in panel B is we added TC5RW at different time points. We added at 20 hours in the green line and 64 hours in the blue line. And we found that the THT fluorescence curve dropped quickly after the treatment. So this indicates that TC5RW can interrupt the prion protein aggregation, which indicates that it can serve as a treatment agent against the protein misfolding. And in our in vivo study, we also treated the 263K infected hamsters with the TC5RW right after the infection. And in the blue line is the TC5RW treated hamsters. And we found that it showed a prolonged survival rate than the control group in red. And in panel B is the IHC result and HE staining. We found that in the IHC result, it showed decreased PRP acid plaque compared to the vehicle-treated group. And in the HE staining result, we found that the spongiform degeneration is decreased in the treated group. So our hypothesis is that the TC5RW could potentially serve as a prophylactic and therapeutic agent for human prion diseases. And our overall game is that to develop the effective prevention and treatment for human prion disease. So in the first part of our ongoing study, we are assessing the prophylactic and therapeutic effects of TC5RW on the transgenic mice that expressing humanized wild-type PRP we named TG40H. And we divided these mice into 3 groups. The first group is the prophylactic study. We aim to understand if TC5RW can prevent the prion infection. And we injected the TC5RW at 4 grams per kilogram of the mice weight, about 3 weeks before the intracerebral inoculation of ICJD bring homogenate. And in the second group is the therapeutic group, and we injected the TC5RW after 4 months after the inoculation of ICJD bring homogenate. And in the third group is the control group. We just inoculated at the ICJD at 46 days and without any treatment of TC5RW. And here's the result of this part. In this panel show the survival curves, and we found that when we treated the TC5RW before the prion exposure, that is our prophylactic group, we saw an improvement in the survival days at around 215 days, which is significantly longer than the control groups, which is around 200 days. But however, there's no significant difference between the treatment group and the control groups. That indicates that TC5RW might work better if treated before the infection. And we also did Western blot of these of the other groups of the mice, and this is representative Western blot of 3 groups of mice: the control group, and prophylactic group, and the treatment group. And this is the quantitative analysis of the gray value of PK-resistant PRP. And we can see that the PRPSC level in the prophylactic group is significantly lower than the control group. However, there's no difference between the control and the treatment group. So to sum up, TC5RW can decrease the amount of PK-resistant form in the prophylactic group of the TG40H mice. In our second study, TC5RW was applied to a different mouse model. We call that TGHU2ME199K, which is designed to mimic a specific human genetic prion disease, E200K. And this particular mouse model starts developing prion disease spontaneously at around 5 to 6 months of the age. And we divided these mice into 3 groups. In the first group, we treated TC5RW at 2 months of the age. We call that young group, which is before the spontaneous disease time point. And in the second group, we will treat the TC5RW when the disease is apparent. We call that as the old group. And in the third group, we call it's the control group. We didn't treat it with any TC5RW. And here's the result. During this study, all of our mice survived, and we just sacrificed all the mice at the same endpoints. And we tracked disease progression and disease severity and progression using a particular scale. And you can see the description in this table. The 0 means no clinical sign, and and when the more severe symptoms appears, the scores will be increased. And we found that TC5RW is more effective in the young group on the left panel, And although in the older group on the right, we found the p-value is still smaller than 0.05, which shows some significance, but it's not as effective as the younger group. And this is the Western blot results of this brain homogeneous. And on the top part is the non-PK brain homogeneous. And we found that the PRP level is very similar in different groups. And when we treated with PK, we found that the younger group, when treated at 3 months, when we do the quantitative analysis, is much lower than the untreated group. And also, there's no significant difference between the untreated group and the treated and the older treated mouse models. So to sum up our current studies, the TC5W has the inhibitic effect in vitro through the direct incubation and also the seeding aggregation. And in the in vivo study, it showed treatment effect in the TG7 mouse models and also the hamsters model. And for the humanized mouse models, it showed protective effect in the prophylactic group, but it's not obvious in the treatment group for both the SCJD and the E200K models. And looking forward, our plans involves to enhancing the efficacy of our treatment approach, like alterations in the administrator routes. For now, we just use a single subcutaneous injection. So we are thinking about to include the subcutaneous implantation that may increase the action time and probably increase the treatment frequency and treatment dose. And we will also consider to add intracerebral injection as a positive control group that may be more direct and more effective. And we will also try to explore the possible binding targets or routes of TC5W during this aggregation process and identify any potential small molecules that could act synergistically with the TC5W to increase the treatment effect. And finally, I would like to thank for all the people listed here from our lab and the collaborators for their contributions and support. And we also want to thank the donors to this grant, all the people listed here, and also thank for the funding from CJD Foundation. That's all. Thank you.